We know it very well that despite our attempts since 1994, when we have statins, since 2003, ezetimibe, and now innovative drugs, we are not effective at all, taking into account the number of patients being on the LDL cholesterol goal. And this is the main problem and challenge, especially for those being after acute coronary syndrome, those with established atherosclerotic cardiovascular disease. My name is Maciej Banach. I'm professor of preventive cardiology and lipidology from the Medical University of Łódź and John Paul II Catholic University of Lublin. I would like to say a few words about the most important results of our very recent analysis that has been just accepted and is going to be published in the forthcoming issue of the Mayo Clinic Proceedings on the impact of lipid-lowering combination therapy of statins and ezetimibe versus statin monotherapy on the reduction of the cardiovascular outcomes. In 2021, in April 2021, based on the results from Da Vinci and Santorini, we decided to introduce by the International Lipid Expert Panel something we called upfront lipid-lowering combination therapy of statins and ezetimibe in order to be on the LDL cholesterol target, not only the lower the better for longer, but also the earlier the better. And then if we fail to be on the LDL cholesterol target, to start immediately the innovative drugs with PCSK9 inhibitors or bempedoic acid. But obviously, there were many questions after these recommendations we published in 2021, because many people expected to have a strong data that upfront lipid-lowering combination therapy is really associated with the reduction of the cardiovascular outcomes. And since that time, there were many different attempts, and one of them is obviously has just been published and accepted for the Mayo Clinic Proceedings. It is the largest ever meta-analysis of 14 studies, 11 randomized controlled trials, and 3 cohort studies with almost 110,000 very high-risk patients. And based on these results, we were able to see that using of upfront lipid-lowering combination therapy, we may expect the further reduction of the LDL cholesterol by almost 13 milligrams per deciliter, more people and more patients being on the LDL cholesterol goal, with 85% increase of the chance to be on the LDL cholesterol goal, without any significant or without any increase of the adverse effects associated with this combination therapy in comparison to monotherapy. And first of all, what is critically important, take into account the expectations and something that we might expect that it will be also included in the forthcoming guidelines. Significant reduction of the cardiovascular outcomes, including 19% reduction of all-cause mortality, as well as 18% reduction of the adverse cardiovascular events, MACE, and 17% reduction of the stroke incidence, with numerical reduction of the cardiovascular mortality by 14%. What is more, based on the, because we wanted also to compare different regimens, therapy regimens, so high-intensity statin monotherapy versus moderate-intensity statin plus ezetimibe and high-intensity statin plus ezetimibe as upfront lipid-lowering combination therapy. We made also a network meta-analysis, and within this network meta-analysis, we confirmed and we saw that these results, the main results, were even more pronounced, because we observed a more significant reduction of the LDL cholesterol by even over 15 milligrams per deciliter in comparison to high-intensity statin monotherapy. We saw a 49% reduction of all-cause mortality with upfront lipid-lowering combination therapy of high-intensity statin plus ezetimibe in comparison to high-intensity statin monotherapy. The same significant 39% reduction of MACE, numerical decrease of the musculoskeletal adverse effects, and what is critically important, taking into account the adherence to therapy and compliance with the patients, 44% reduction of the risk of discontinuation. For those with established atherosclerotic cardiovascular disease and after acute coronary syndrome, upfront lipid-lowering combination therapy should be a gold standard and should be included, as it was for ACS guidelines of the European Society of Cardiology in 2023, as a gold standard for those patients being at a very high cardiovascular disease risk. Thank you very much.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.